Welcome to MedMadness, where we delve into critical medical topics to aid your preparation for the USMLE. Today, we'll be discussing an important and often misunderstood condition, postpartum psychosis. This condition, though rare, is a psychiatric emergency that occurs shortly after childbirth and demands immediate attention. Understanding postpartum psychosis is crucial for ensuring the safety of both the mother and her newborn. Next, let's discuss the nature of postpartum psychosis. Postpartum psychosis is a severe mental health condition that typically emerges within the first 2 weeks after delivery. Unlike the more common postpartum blues or postpartum depression, postpartum psychosis involves a complete break from reality. This disorder is characterized by the sudden onset of delusions, hallucinations, and disorganized thinking, often accompanied by severe mood disturbances such as agitation and insomnia. The prevalence of postpartum psychosis is relatively low, affecting 1 to 2 women per 1,000 births. However, for those affected, the consequences can be devastating if not addressed promptly. The clinical features often include bizarre behavior and psychotic symptoms such as delusions, beliefs that are disconnected from reality, and hallucinations, where the individual may see or hear things that are not there. These psychotic symptoms often center around the infant, which can manifest as delusions that the baby is somehow evil, shrinking, or in danger from imagined threats. One of the critical risk factors for postpartum psychosis is a history of bipolar disorder. Women with this psychiatric background are at higher risk of developing psychosis after childbirth, and they also face a heightened risk of recurrence in future pregnancies. The urgency of recognizing and treating this condition cannot be overstated, as the affected mother may be at risk of harming herself or her baby. Now let's move on to a real-life case study that illustrates the severity of this condition. Consider the case of a 29-year-old woman who had no significant psychiatric history but had recently given birth to her first child. Within a week of delivery, her family noticed that she was acting strangely. She became agitated, was unable to sleep, and started to believe that her baby was shrinking and that the doctors were plotting to harm the infant. She also began hearing voices that told her she was a terrible mother and that her baby would be better off without her. Recognizing the severity of her condition, her family brought her to the hospital, where she was diagnosed with postpartum psychosis. Due to the high risk of suicide and infanticide associated with her condition, she was hospitalized immediately. She was started on antipsychotic medication, and her condition gradually stabilized. This case highlights the critical importance of early intervention and treatment in postpartum psychosis. In summary, postpartum psychosis is a rare but severe psychiatric emergency that typically occurs within the first 2 weeks after childbirth. It is characterized by delusions, hallucinations, and disorganized behavior, often with mood disturbances. Early recognition and treatment are vital to ensuring the safety of both mother and child. Remember, women with a history of bipolar disorder are at increased risk, and immediate hospitalization is often necessary. Thank you for tuning into MedMadness. Don't forget to take the pre- and post-podcast quizzes and use the Anki flashcards to reinforce your understanding of this critical topic. Your active engagement is key to mastering the material and ensuring you're prepared for your exams. Until next time, keep learning and stay curious.